We have with us T.S. Singhdev, the Health Minister of Chhattisgarh, live. Sir, appreciate you speaking with us. Once again, we are in the middle of a wave. The Omicron variant is wreaking havoc across the country. A number of states, including Maharashtra, Punjab, as well as Delhi, have gone on to say that they will not be imposing a lockdown. But, the past has been testament to the fact that scientific advice is primary when it comes to taking such decisions. Chhattisgarh itself is facing a number of issues and problems, and the trajectory is only going up. What are your plans?
The figures are likely to go up further. Yesterday's total number of active cases in the state were 13,066, though the days positive numbers were 3,465. So these are numbers which are going to go up. We are anticipating that we would maybe touch or cross 20,000 positives in a day, which would have more than challenged our health care infrastructure which we have so far prepared. In the public sector, we have 18,772 beds, say roughly 19,000 beds with us, of which about 5,900 are plain beds. The other about 9,000 beds would be with oxygen, 1,350 roughly HDU beds, about 1,350 ICU beds, and similarly about 1,150 beds with ventilators. So this is the limit so far. It will be very difficult to ramp up this infrastructure in a very short period of time. So as with cases abroad, and presuming that the severity will remain as it is appearing to remain today, probably the infrastructure will not be challenged in terms of availability of beds. We are trying to arrange isolation beds independent of these 19,000 beds I have mentioned, so that those cases who don't need to be sent for hospitalization do not take up the hospital infrastructure available for more serious patients. So that triaging, as they call it in medical parlance, we are trying to implement it with greater awareness and more strict norms, that only those who need to be hospitalized should be hospitalized and not take up the bed strength. If the numbers go beyond what was there in the second wave, and the number of patients who are serious come up to those numbers which were there earlier, we'll be just about level. If they increase, then the beds will fall short.
So, would you concur that in case the spread worsens from here and the number of cases are larger than what you had anticipated, that there could be a chance of a lockdown?
We are already approaching lockdown percentage numbers already. The average positivity in Chhattisgarh yesterday, for example, would have been 7.43, which is pretty high, of which there would be 6 or 7 cities, larger towns, where the positivity is beyond 15%. So with 5 of our larger cities recording a positivity of more than 15%, we are already, so to say, in the lockdown phase. But the other aspect for lockdown is how many beds are available. So not just the positivity, if you balance it with the number of beds available so far, we would be taking a call for lockdowns if these numbers of positive patients rise and bed occupancy touches about 50%. Then we would be thinking of a lockdown.
So what about vaccination? Do you think that the fervor of the vaccination should continue despite the Omicron threat, or do you think that also needs to be calibrated now, or recalibrated rather?
It needs to be recalibrated in the sense that we need to get everybody under the umbrella of the third dose. We have 96% first dose coverage already in Chhattisgarh. We would be about 66% second dose. A number of those who have not taken second dose have not reached the 12-week point where they need the second dose of Covishield. So those numbers are fairly okay. We have 40% children 15 to 18 already vaccinated during the first 4 days. So that is progressing satisfactorily. Government of India has arranged for Covaxin to be available in sufficient numbers for us to do the 16,39,000 children which have been earmarked, 15 to 18 group. But then this is 15 to 18. We have to get to 12 to 15. We have to get to 6 to 12. We have to get the third dose for all citizens. So those numbers then would be larger, and we need to recalibrate in terms of production and also availability of vaccine.
So what are your thoughts on, a number of experts saying that this is the endemic stage that we are approaching? The virus is ending, and that's why it's become, innocuous in nature, it's harmless in nature. Whereas there are people in the health fraternity who are also saying that it's only a matter of time before a much more virulent virus is mutated because of so many people contracting it. What side of the spectrum do you believe in?
The scientists have been telling us consistently that all viruses are subject to mutation. And the coronavirus itself has probably seen more than 14,000, 15,000 mutations, if I'm not wrong, maybe more. So of these 15,000 mutations, we have had those mutations which have caused us concern, not interest, but concern. They are the Delta variant, they are the British variant which had come earlier, it is the Omicron variant. So what is going to happen in the future, we don't know. We should not preempt that. We should be hopeful. And as far as the pandemic and the endemic part is concerned, there is this simplistic view that is told to us laypersons, as we are not experts, that probably the virus also wants to stay alive. If it has cognition, it would like to stay alive, and to stay alive, it needs the host to be alive. This is the lighter and brighter side of things. So to keep their hosts in place so that they could find place there, they would not want their population to be wiped out. So that is where the theory goes into, that now we are probably entering into the endemic stage, and the endemic stage is not the end of the virus. It just makes it less virulent. It is not a pandemic to that. It will become a flu. It will become influenza flu, for which America is taking vaccines every year. We are being told that now it's probably every 6 months we may need to take these vaccines. So that is the stage we are entering into. Hopefully, as things seem today, the virus that has mutated is less virulent. It's far more spreadability it has, but the impact on the body is less severe.
Absolutely. Sir, appreciate you taking out the time apart from your busy schedule and speaking with us. I know these are testing times for all of us, and especially you. Appreciate you taking out the time and speaking with NewsX. Dr. Raina, if I can come to you, the Health Minister